All right, thanks a lot, Lainey. Well, if you've ever had surgery, you know how bad the pain can be when you wake up in the recovery room. It can be so intense, it just takes your breath away. But now doctors at Wake Forest University Baptist Medical Center have found a solution. We get more now from Kimberly Van Scoy.
Cletus Snyder gets around pretty easily these days, a far cry from earlier this year when he began to have severe pain in his knee that made walking difficult.
It was becoming almost impossible. I couldn't walk 50 yards without bending over almost.
In June, doctors replaced his knee. Snyder dreaded the recovery, expecting it to be painful, but it wasn't.
I didn't have any great pain.
In fact, he didn't take a single painkiller for a week.
We made an injection of the long-acting pain medicines right here.
Partly because he had a numbing medicine called Depador injected into his knee before surgery.
So we make a single injection of about a thimbleful of pain medicine into the epidural space. It's slowly released there near the nerves that go to the knee, and those nerves are given pain relief by the release of that medicine.
The drug keeps the knee numb for 2 days, which is critical to recovery.
If you don't take an aggressive approach, patients can't do their physical therapy. They can't get better. They can't leave the hospital because you have to do the physical therapy to get out of the hospital.
Snyder was able to do his physical therapy pain-free, and just 3 months later is almost back to his old self.
I'm doing about what I want to. I mean, maybe a little slower, but I'm doing it carefully. But I'm doing about what I want to.
Depador, which is morphine-based, is FDA approved for use during knee replacement surgery. It's also being studied for C-sections, hysterectomies, and hip replacements. Kimberly Van Scoy, WXII 12 News.
And studies show that patients who are given Depador have shorter hospital stays and end up using fewer painkillers overall.